This is Dr. Jeff Wasserman with Lake Point Orthopedics and Sports Medicine with offices throughout the Dallas and Rockwall, Texas areas. I am a board-certified interventional pain medicine physician specializing in the treatment of chronic back and nerve damage pain. This video will discuss a common source of chronic back pain caused by inflammation of the sacroiliac joints. The video will describe when the sacroiliac joints cause pain, how this is diagnosed, and the various treatment options available. The sacroiliac joints, commonly called SI joints, are located at the lower part of your back, where your spine meets your pelvis. You have two of them, one on each side. The sacrum is a triangular bone at the base of your spine, and the iliac bones are the large, curved bones that make up the sides of your pelvis. The SI joints connect these two structures. The SI joints aren't like most joints in your body. For example, your knees or elbows are hinged joints that move a lot. The sacroiliac joints don't move much at all. Their main job is to absorb shock and provide stability to your pelvis and spine when you move. They help distribute the weight and pressure from the upper body to the legs, making sure you can walk, run, and stay balanced. When the sacroiliac joints become irritated or inflamed, it can cause pain in your lower back, hips, or buttocks, and sometimes even radiates down your legs. Common causes are trauma, repetitive motion, or even just wear and tear over time. The diagnosis of SI joint pain can be difficult since this often mimics other causes of back and leg pain. Taking a good history from the person with pain is important. The pain is typically felt in the lower back, buttocks, or posterior hips, and may radiate to the groin or thighs. Pain is often worse with prolonged standing, climbing stairs, or weight bearing. There may be stiffness, especially in the morning or after prolonged inactivity. There may be a history of trauma or inflammatory diseases such as rheumatoid or psoriatic arthritis. The physical exam is just as important. There is usually tenderness over one or both SI joints. The exam must also include at least a few unique provocative maneuvers designed to increase the pain when applied. Provocative tests include the Faber test. This stands for flexion, abduction, and external rotation. Compression tests involve applying pressure to the sides of the pelvis. And the thigh thrust maneuver, performed by pushing the thigh downwards as shown in this illustration. Pain with any of these tests suggests the presence of SI joint inflammation. Imaging studies may show evidence of arthritis within the SI joints, but these are notoriously unreliable for diagnosing pain generated by the SI joints, since many people with arthritis noted within their SI joints on imaging studies actually have no pain. So ultimately, the diagnosis of SI joint pain is clinical and based largely on the experience and skill of the practitioner. Once properly diagnosed, there are several treatment options available for chronic pain secondary to SI joint inflammation and dysfunction. These include lifestyle modifications such as weight loss, anti-inflammatory medications such as ibuprofen or stronger prescription pain relievers, physical therapy, chiropractics, acupuncture, steroid, prolotherapy, or platelet-rich plasma injections. Platelet-rich plasma is also known as PRP for short. A chiropractor or physical therapist can help develop exercises that strengthen the muscles around the SI joint, improve posture, and increase flexibility. Deep heat, massage, and cold laser therapy can be applied. They can also try to manually manipulate the joint into a less painful position. Steroids or prolotherapy can be injected into the joints or surrounding ligaments. Steroids are very effective at reducing inflammation and pain for several months after each injection. Prolotherapy uses irritants injected into joints and surrounding tissue to stimulate the healing process and has variable results. PRP and bone marrow cellular therapies are tried and proven techniques that may offer several advantages over steroid injections, but can be expensive since they are not covered by insurance. They have reduced side effects and usually longer duration of relief. PRP and bone marrow-derived cells utilize beneficial proteins and growth factors within the patient's own platelets and bone marrow cells to reduce inflammation and promote healing. Finally, if more conservative measures fail, SI joint fusion is an option to permanently stabilize the joint. I would like to describe the SI joint fusion procedure in more detail. There are several different types of fusion systems available for physicians to use. I use the Transloc minimally invasive device. I start by carefully making measurements of the pelvic bones and sacrum under fluoroscopy. Then through a half-inch long incision, I place relatively small titanium screws through the iliac bone of the pelvis, across the SI joint, and into the sacrum. The screws are designed so that the patient's surrounding bone will literally grow onto the surface of the screw, permanently stabilizing the joint. The whole procedure takes 30 minutes under light sedation and is very low risk. The beauty of this technique lies in its minimally invasive nature. Patients experience less muscle disruption and can enjoy a quicker recovery compared to traditional fusion surgery. Most patients see a significant reduction in pain and an improvement in mobility within a few weeks after the procedure. It's an exciting and highly effective way to help individuals regain their quality of life and enjoy greater movement and comfort. Although some discomfort at the injection or surgical sites are not uncommon after SI joint procedures for limited periods of time, any significant complication is very rare. If you have any concerns, please do not hesitate to discuss these with Dr. Wasserman or his staff. If you are having sedation, you will have the opportunity to discuss anesthesia details with your provider shortly before your procedure. Dr. Wasserman is a board-certified anesthesiologist and can answer most of these questions for you as well. Preoperative instructions. Please have nothing to eat or drink after midnight before your procedure. You may take blood pressure and pain medications with a sip of water in the morning prior to leaving for the surgical facility. It is very important that you discuss blood thinner use, including anti-inflammatory medications, with me or my clinical staff, since these medications need to be discontinued before the procedure, and each medication has unique directions for discontinuation. Avoid use of GLP-1 inhibitors like Ozempic for at least 1 week prior to procedure due to delayed gastric emptying and anesthesia issues. Shower the morning of the procedure and scrub your back with Hibiclens body wash or soap to more fully disinfect the skin. Post-operative instructions. Preoperative pain medications can be used as usual, but hopefully can be reduced over a few weeks after the injection or fusion as pain relief kicks in. You can shower immediately, but avoid standing water like a spa or swimming for at least 2 weeks after an injection and 4 weeks after a fusion procedure. You can begin to gradually return to normal activity over the course of 7 days. If you had a fusion, you should avoid vigorous activity for at least 4 to 6 weeks to allow bone ingrowth and stabilization of the screws. You do not need to live with chronic pain due to SI joint inflammation. Various minimally invasive treatment options are available to help you get you back on your feet and functioning. I hope you found this video helpful. If you have further questions, please do not hesitate to contact us at Lake Point Orthopedics and Sports Medicine.